we are back here on Healthy Living. I'm very excited to introduce to you Dr. Addison Wilson. Thank you so much for joining us. You are one of the newer members with Novant Orthopedics, and thank you for taking time out of your busy day.
I'm glad to be here.
You know what? First things first, I think we would love to know a little bit about your background and how long you've been here in the Lowcountry.
So I'm native South Carolinian. I was born and raised in Columbia, to West Columbia to be exact. I was in the Navy for the last 24 years, and I just retired just in this past month. And I've been very fortunate. My family and I have been able to live in Beaufort for the last 9 years. The Navy doesn't usually do that, but COVID did a lot of bad things. But one of the good things COVID did is it kept me here in the Lowcountry, and got my kids through high school. And my wife and I just celebrated our youngest graduating from high school. But I've been very fortunate to get to live in this area, taking care of the active duty military population with the Marines on Parris Island and the Marines at the air station. And so I feel very fortunate to get to stay in this area where we've made a lot of good friendships, and we love the Lowcountry.
I love it. Talk to me a little bit about where you did your education.
After high school, I went to the Naval Academy in Annapolis, Maryland. After graduating from there in 2001, I then went to the Military Medical School in Washington, D.C. for 4 years.
Oh, wow.
After graduating from medical school, I went to San Diego, California, and did a surgical internship there. And immediately following there, I did dive medicine, learned how to work a hyperbaric chamber with the dive school, and was a primary care provider with the SEAL teams on the East Coast. And that was a very exciting time in my life. Got to deploy and really got to see America's warfighters in action and be their care provider for 2 years. After that time, I went back and did orthopedics in Virginia, where we lived with for 6 years. From there, I was stationed overseas for 3 years and back in Beaufort for 9 years, providing as an orthopedic surgeon.
Oh my gosh. So what is your passion? Is there something that you particularly love about the field of orthopedics? I find it fascinating.
I really love fixing a problem and then the next day talking with the patient, and the pain that they had is gone, or they're able to mobilize better. There's just a lot of immediate gratification in orthopedics. If you go to other medical fields, it takes weeks and months for some things to show up and really take effect. And in orthopedics, when you have a broken bone and it gets fixed and stabilized, people's lives are immediately changed, and it's very gratifying as a surgeon to see that.
It's really interesting because I have, as I'm getting older, I have 10 grandchildren. But what I find is that we all talk about something with our bones and system. In other words, I'm finding that when I'm playing tennis and I do this, sometimes it hurts, or my knee might be a little tender, and I laugh because my kids are swimmers and they have the exact same grumbles and complaints that I do, and they're like your kids, they're in college. So talk to us about the system, the orthopedic system, and at what point in time do I need to be worried about my symptom and my discomfort, and at what time do I need to just sort of tough it out?
Well, it's I like to use analogies a lot, and it's like a car. When a car starts making a funny noise, you can ignore it, or you can take it to the auto mechanic and have them take a look at it and fix it before it becomes a very expensive problem. And ultimately, it falls back on a very simple principle: is every big problem starts with a little problem. And so when you're having a little bit of discomfort, it's nice to catch it early. We have amazing physical therapy in this area, and there's a lot of things that can be done before getting to surgery and or before even needing surgery. And so I'm a big proponent of catching things early and using all the resources we have before going to the operating room, and hopefully avoiding the operating room at all costs. So that's what I would, when people have pains playing sports and stuff like that, I really turn them loose with physical therapy before I even consider surgery.
So what I really hear you say is I don't need to be embarrassed if my elbow hurts or my shoulder hurts or something like that. If it's causing me some discomfort and I'm not really sure what it is, it's better to be proactive or preventative and get in and let you guide me before it's something that really does require some major surgery.
I'm a big fan of that. I love small problems. I can fix small problems a lot easier than I can fix big problems. And so if I can catch it small, it's a win-win for everybody.
You know, it's really interesting. We live in the Lowcountry, and you know this, you were raised here. We are an athletic, or at least we are a sports-oriented group here. And again, it doesn't matter what our age is. Do you find that as we get older, if we had a little more education, a little more information, we could prevent some of the injuries that that are common now?
I think so. I think of just like regular maintenance on a car. I go back to that analogy.
Yeah.
If you just continue to put good gas in it, you get the oil changed on a regular basis, you do that regular maintenance on your body, health-wise, you're going to get all the miles out of it that you possibly can, orthopedically and included. And so if you haven't driven that car in a long time and you take it on a long road trip, it's not maybe the best idea. You need to get it road tested before you just take off and go too fast.
So within your practice, what are some things specifically that you enjoy doing that are surgical?
So I really like shoulders. I like treating shoulder instability. I like rotator cuff tears. I like fixing things, if I can, arthroscopically. So I'm combining sports along with fracture care. And so a combination of sports and trauma is really my favorite, one of my favorite things. Joint replacement is very satisfying because patients, you usually see when it goes well, it goes really well, and you see immediate gratification. Those are a couple of my favorite things.
Are there areas of our body that are more susceptible for injury as we get older? Are shoulders more susceptible, or knees or hips? Because that seems to be within my 70-year-old age group what people are struggling with. Or elbows? Well, wait, I could keep going, couldn't I?
Yeah, you know, it's all depends on how what you've done your whole life, and all it takes is an accident. You know, you trip and you break your ankle, or you sprain your ankle when you're in your 20s, and all those miles that you put on your body, and you get to be 60 and your ankle turns into being a problem. Hips can be the same way, knees can be the same way. All it takes is a minor injury in the past that kind of continues to linger, and then all of a sudden that joint acts older than the rest of your body, and it happens to all of us. And so usually there's some kind of sports injury in our past that comes back and ages us faster than the rest of our body, and so that's not a very common thing.
I know we've only got about 45 seconds, but from an evolution point of view, from when you started practice, are your treatment interventions and procedures exponentially different than when you were first in practice?
There's some minor things. One of the most common things is pain medication, getting away from narcotics, utilizing anti-inflammatories. I'm a big proponent of not using narcotics or minimizing narcotic usage. And one of the ways we're doing that is with local anesthetic injections at the time of surgery. And that has really revolutionized orthopedic surgery because it doesn't hurt as bad. Orthopedic surgery, when done well, people get off of pain medications very quickly.
I think this is absolutely great. This was a quick interview, and you are so articulate and really user-friendly and easy to talk with. We hope you'll come back and talk to us again here on Healthy Living. So Dr. Addison Wilson, thank you so much for joining us.
Thank you. Have a great day.
All right, bye-bye now.